you can go to clean gloves rather than sterile gloves, okay? So I'm gonna say, I already did all of that. Josh, I'm just gonna ask you to open the cover of the, so we're gonna say she has, can you just uncrush your legs for me?
Yep.
Can everybody see okay? Because this is sort of in a, so now I'm sterile, this is my sterile field, so I'm gonna start picking from my sterile field. Remember Josh asked you to put it in order, and the reason being is, I don't wanna cross over the top of this to get to that, okay? So when you are truly sterile, I shouldn't be reaching over this, so we'll take a route that way. All right, so I'm gonna take this, hang on, sorry. Gotta start all over again, we gotta go back to the scratch. So we have a wound and we need to put medicine on it first, okay? So I'm going to take my applicators. We don't really have to, this is just massage lotion, and we don't really need to stick these in here because it'll just get messy. So I'm gonna stick it in. I'm gonna make one swipe down the wound, okay? We don't rub it around, mix it in, okay? One swipe you're allowed, okay? And then you would throw this into your trash. I'm just gonna put it off to the side. You would take another applicator, and I would put another swipe, okay?
How come you need a fresh applicator for the second one? Cross-contamination, right? We don't wanna just take it from the patient and throw it back in there, cause now all that's.
Did you already clean it?
Yeah, it's already clean, that's what I meant. And I can sort of do it in reverse, tell you what's gonna happen from there. Okay, so now it's all clean, it's ready to get wrapped up. So now I'm gonna put a gauze on. All right, once the gauze goes on, if my gloves are really dirty or like have a lot of debris, we don't want to put that all over the rest of the dressing. So I would either, my gloves are clean so I don't have to do it, but I would change into clean gloves rather than sterile gloves if they were really dirty, okay? Next, I'm gonna take my gauze. Trick of the trade, when you go to roll something on someone, they haven't learned how to roll, okay? So we try to wrap in a figure 8 format, and we try to go distal to proximal, and why do we do that? Push blood back to the heart, right? And we also have to be careful how tight we're putting this on our patient, okay? Because we don't want to cut the circulation off. We're working on getting that blood flow there to heal this, okay? So I usually start in the middle. I try not to start directly over the top of the wound. I'm gonna be a little bit more freewheeling. I would have had her a little bit closer to the edge so that I don't have to do this over it, okay? So when I roll, see how it rolls out this way? Don't put it on this way because it's more difficult to roll, and you want it to be your friend, you want it to be rolling with you, okay? So there's a pretty huge difference when you put it on this way and when you put it on this way. Students always want to put it on this way. It's just harder to roll in your hand. This way it just unravels for you, okay? So I would start, can you just bend up just a little bit? So I would have her set up so that she doesn't have to hold herself up. And I'm being careful not to have any wrinkles in this material, okay? Because we don't want to cause any more problems. Can you just go up just a little bit? Any more problems than we already have, okay? So once you get around one time, okay, is that okay? So always check in with your patient, all right? So I'm just rolling around, and now you'll see me come back up, and then come back down. Okay, so I'm doing a figure 8 format. Okay, back up. And it makes a very pretty, if you get good at this, they come out really pretty. And I'll tell you my secret, I don't do this, but my mom and dad had racehorses and we used to have to put bandages on them. So that's why I'm so good at it.
You're not sterile
So,
at this point?
huh?
You're not sterile?
I am no longer sterile, no. But I also don't wanna be like dragging things all over the place. So once you get to the end, you wanna have an inch, so I probably should have started a little higher. I wanna have an inch on each side. And then you can either finish this up or you can cut it. And once you're at that point, you're going to have, Josh, can you be my assistant and open some tape up for me, please?
I have a wedding sign, maybe I'll wear it. Scare us away. It's not contagious. Yeah, we get married on Thursday at 5.
Interesting.
At 5.
Oh.
Yeah.
It's cheap there.
It's cheaper, yeah.
It's just cool.
Okay, so once this is done and I have taped it down, I'm also gonna put on an ACE wrap. So ACE wraps, now we're like really far from the wound, so these are a little bit more liberal. So normally when you go into a facility that does sterile gowns, you're gonna have all sizes of these ACE wraps. We only carry this one because it's sort of the universal one. All right, but depending on how big their leg is, like how big the wound is, you may need one, you may need two, so you're gonna have to sort of evaluate that. These can also be washed. They can be given to the patient to take home, and sometimes they'll come in and they'll be like grungy and disgusting, and you just wanna cut it off and get rid of it. So you kind of have to monitor what they're doing with their ACE wraps. And I made a mistake. I didn't go distal to proximal, which I informed you that I was going to. So I would be starting over again for the third time?
Yeah.
Time? So again, we're starting here. Remember, where your wound is, you want to go an inch on each side, just in case there's drainage or, it slips or anything like that. It needs to be tight enough, like you can see this, like I don't want to go like this with it because that's going to cut off circulation, right? But a little bit taut, and I feel like your first roll always helps you a little bit. Okay, so same thing, notice my ACE wrap is rolling the same way, and I'm doing the up-down procedure again.
Wait, would you leave that?
No, I wouldn't,
No,
but I just
yeah,
didn't want to cut it.
Cause that's an area of increased
Yeah.
pressure, it would cause a problem,
Right.
yeah. Yeah, that's just for us for class for today.
And also you said, would you use pillows to prop her leg up on its own?
So remember, if I used pillows, it's still against that. So I might use like a pillow at the end of her ankle. It's gonna depend like
Footstool
size of
or
the
something,
leg,
yeah.
yeah, so that you can get where you need to be. All right?
Well, like, would you roll like a towel underneath or something?
Yeah, you could.
In a hospital, it would be a traction.
Could be,
I just
where,
say pillows
in
can
the
solve
hospital
it.
setting, here's what I would think. Jonathan, come here and hold up this leg while I wrap this leg. Yeah, that's what I think, that's what I think. And we have to know where the sterile field is, how do we have to know all of those details to not mess up our experienced practitioner.
Yeah, that's great.
In the skilled nursing facility setting, we're probably be the ones wrapping and dressing, and someone else is holding the leg while we do that.
So
Home
do
care,
you
you
want-
gotta figure that, whatever.
Do
Alright,
you
so.
want me to go backwards?
So
that I
now
can see?
we are dressed, so typically our patient would start like this, so now we would be able to remove the dressing with our non-sterile gloves and non-sterile gown, face shield, depending on, what the precautions are. So non-sterile gloves, we'll be able to take that down. That's where we get to use the scissors to cut that wrap. We're not gonna cut our material for today because we wanna reuse it. But, to do that, I'll show do we have non-sterile gloves around?
Yeah, down the end of the table.
I'll show that.
So you should grab a set of non-sterile ones too.
Thank you.
And remember, we would cut it if it's messy and dirty in the ACE wrap. But make sure that you're
Alright,
conscious
next
of tipping the blade of the scissor away from the skin so we don't cut them, okay? I feel like this is a thick material to cut, and I don't do that unless I have to, okay? I might cut the gauze.
Alright, so I've already washed my hands, I've already introduced and obtained consent. non-sterile gloves applied. First up, remove dressing and bandaging. And I have my little trash ready for us too. When I'm removing the ACE wrap, I like to roll it up as I'm doing that because I'm gonna have to roll it up at some point anyway. So I like to do it all at once.
Unless instead of doing it, we're throwing it away.
If I know I'm gonna throw it away, then yeah, I just rip
Or
it
at least
apart.
you might get halfway through and be like, I'm throwing this away.
If it's in good condition and you were going to redress the wound, you could use it again.
Yes,
Yeah.
because
You can, but it's not sterile.
because it's blocked.
To need to be
It's, the wound is blocked not only from the gauze, but also the additional wrap, the sterile wrap too, so.
And sometimes, like, if you were in a facility that had tons of these, you might give them that one to take home and wash, so that when they're wrapping their own, they have some to go back and forth with. That's what I want. Huh? Yeah.
Alright, so then from here,
You
I
can
could,
scissor that one.
I could cut away from where I think the wound is, and then I can remove it. This one here, we're gonna unwrap just so we can save it.
Does it matter if you cut up towards or down?
No, your mechanics matter on that.
You just wanna cut
Away
away
from
from
the
the
wound.
wound. So you wouldn't go zipping up the front, you might wanna go off to the side or off to the sideways.
So when I took this off, the gauze already fell off. Most of the time it's gonna be adhered a little bit to that. There's gonna be some sort of exudate that glued it down. So, so then to remove that, I'm gonna grab at the periphery and then I'm gonna pull towards the center of the wound to take that apart and it'll come off and then I get to throw that away. Now, once that's there, I take these off with my proper technique. And now I get my sterile stuff and all of that, okay?
You wash your hands so bandages all sterile.
Yep. Always.
And just don't forget the technique that we use to ungarb ourselves. And this stuff here, the sterile, what is no longer sterile but was, would go in a certain vesicle that, you know, we don't wanna put this in with our wash, or this needs to